Hello, everybody. My name is Lauren Ford, and I'm a second year Master of Athletic Training student. And I did my CAT topic on the perception and experiences among lesbian, gay, bisexual, transgender, queer, intersex, and agender patients of quality of care with healthcare services. Hello, everybody. My name is Lauren Ford, and I'm a second year Master of Athletic Training student. And I did my critically appraised topic on the perceptions and experiences among lesbian, gay, bisexual, transgender, queer, intersex, and agender patients of quality of care with healthcare services. So I want to start off just by reading this first question. Hello, everybody. My name is Lauren Ford, and I'm my second year Master of Athletic Training student. And I did my CAT topic on the perceptions and experiences among lesbian, gay, bisexual, transgender, queer, intersex, and agender patients of quality of care with healthcare services. So I want to start off just by reading this first sentence for you. The LGBTQIA community are individuals who do not conform to the social norms of gender, sex, and sexuality. And unfortunately, many of our healthcare professionals assume that these individuals' healthcare needs are the same as their heterosexual counterparts, and that is just simply not the case. And that's kind of why I chose this topic. These individuals have a unique set of healthcare needs, and they do experience a lot of barriers to get healthcare in general. So my focus clinical question was, what are the perceptions of quality of healthcare experiences among LGBTQIA plus patients? I did my search terms as lesbian, gay, bisexual, transgender, queer, or genderqueer, or non-binary, and discrimination in healthcare. And I wanted to include articles that investigate quality of care among these individuals, who included their perceptions and experiences, but I did want to exclude articles that included specialty healthcare only, like oncology, end-of-life care, OBGYN, etc. And I didn't want to just look at one group within the community. I wanted to look at several groups. So 4 articles matched my search strategy, and these are the ones starting from left to right. Allie, are you kidding me? Stop. Hello, everybody. My name is Lauren Ford, and I'm my second year Master of Athletic Training student. And I did my CAT topic on the perceptions and experiences among lesbian, gay, bisexual, transgender, queer, intersex, and agender patients of quality of care with healthcare services. And I chose this topic because unfortunately there is a stigma in healthcare about these individuals, and many healthcare professionals assume that their healthcare needs are the same as those of their heterosexual counterpart, and that's just not the case. And these individuals do experience a lot of barriers to healthcare services. And we're going to get into why in just a little bit. So this focus clinical question was, what are the perceptions of quality of healthcare and experiences among LGBTQIA plus patients? And I wanted to include articles that investigated quality of care among the LGBTQIA plus community, and ones that included their perceptions and their experiences. But I did want to exclude articles that included specialty healthcare only, which included oncology, end-of-life care, OBGYN, etc. And I didn't want to just look at one group. I wanted to look at multiple groups within this community. So starting left to right on this table, 4 articles matched my search strategy. And this first one was a qualitative interview that included 10 genderqueer non-binary individuals. So they were interviewed with a semi-structured guide that included 12 open-ended questions that fit into one of 3 domains: healthcare experiences, barriers, and desired improvements. And the second one was a qualitative survey. Excuse me, sorry. So 132 anonymous individuals completed a web-based survey that included 60 items and was divided into 4 categories: demographics, knowledge, attitudes, and behaviors. And the third one was a mixed method study. So it included a interview and a survey. So there was 206 individuals in this one, and they were asked whether or not they had disclosed their LGBTQIA identity to their healthcare providers, and if why or why not. And this last one was a qualitative survey, so 119 individuals completed a survey that included 65 items, and the survey was divided into categories like socio-demographics, general and sexual health, gender and sexual identity, healthcare access and use, and experiences, interactions with clinicians. So ultimately, these articles found that there was a lack of cultural competency that led to these individuals feeling misunderstood by their providers, and that policies and procedures absolutely need to be updated or changed completely to tailor more to these individuals. There was a lot of these individuals who did and did not decide to disclose their identity. Those who did not feared it was due to internalized stigma, lack of inquiry, or belief that healthcare was not related to identity. And then those who did decide to disclose experienced a wide range of discrimination to belief to affirmation and respect. And those who had better experiences, those experiences included inclusive language and culturally competent providers. And then those who had negative experiences, those included a lack of cultural competency, misgendering, transphobia, homophobia, and all the sorts of like. And then some things that LGBTQIA plus patients wish providers knew had knowledge about their healthcare needs and created welcoming environments. Use signs, or the equality sign displayed that, and expected not to be educated by the patient. So the clinical bottom line was like these individuals felt most providers did not have the adequate knowledge or understanding to care for them properly, and as I mentioned before, had positive experience when inclusive language was used. The provider had cultural competency and treated disclosure of identity as routine and created those welcoming environments. And then conversely, negative experiences happened when they were misgender, there was a lack of cultural competency, and the transphobia and homophobia. And overall, there was a wide range of patients who did decide and did not decide to disclose their identity, and they all had different reactions, ranging from discrimination and disbelief to affirmation and respect. And those are my references down there. Thank you so much for listening to me. I'm sorry I'm a bit sick, but I hope you guys enjoyed. Thank you.